connecting to cloud. طيب يلا توكل على الله.
بسم الله الرحمن الرحيم والصلاة والسلام على رسول الله الكريم سيدنا محمد وعلى آله وصحبه الطاهرين. آسف للتأخير. نرحب بكل الحضور الكريم. Continuing to offer the best. The Tabab Advanced Learning Center is blessed to be with you tonight in a very valuable online session that will be presented by Dr. Imad Hassan, titled Systems Thinking, and will be followed by another 3 valuable sessions. I am Dr. Taysir Kashif, Director of the Tabab Advanced Learning Center. I would like to welcome you all again. So, Systems Thinking with فضيلة الدكتور عماد حسن هو أحد مؤسسي الطبابة وما أدراك ما الطبابة. دكتور عماد حسن, Head Section Assistant Professor, Consultant, Internist, Pulmonary Medicine. He is a highly qualified and experienced clinical and academic consultant physician with an outstanding track record in hospital-based patient care and academic training of clinical staff and undergraduates. Dr. Imad has exceptional teaching and training skills and chosen before as best tutor 6 times. His credentials include also curricular development, implementation, and assessment in competency-based, outcome-focused, and medical education. Also, scheme-based using cognitive aids education for clinical thinking, critical thinking, problem solving, and effective decision-making. Dr. Imad is expert in education, training, and implementation of evidence-based medicine, conducting and monitoring in morning meeting, journal clubs, medical audit, medical research, etc. And he is graduated from University of Khartoum and has acquired the MD from University of London and is fellow of the American College of Physicians and the Royal College of Physicians. Before we start, please make sure you mute your mics. Comments, please press the hand icon. قبل ما نبدأ بس تأخرنا معلش أنا أرحب فضيلة البروف وصال نبك وبروف محمد المعتصم، أستاذنا صلاح مغربي ودكتورة دالي علام. دكتور عماد, we are honored to be with you in the presence of your abundant knowledge and experience, and thank you for giving us this opportunity in our valuable lecture series. Thank you for master your ground. تفضل مشكورا بروف عماد.
بسم الله الرحمن الرحيم. السلام عليكم ورحمة الله. الحقيقة مشكورين كل الأساتذة, our professors and colleagues, and your presence here today is really an honor to me. I promise you, actually, to start with, I promise you 2 things. Now that you will never regret attending this session, this talk, I can assure you of that. And I can also assure you of another thing, that I am actually going to change your mindset totally. By the end of this talk, your way of thinking will be dramatically different, right? And I can confidently tell you that, because whenever we have actually presented this session or talk on system thinking, right, people at the end said, oh my God, we were doing things or thinking in a totally wrong way. Now, I must really start by giving you a warning. Now, the whole training session on system thinking takes a full day. Now, I'm trying to give it really in a much shorter time. In a full day workshop on system thinking, we have hands-on exercises, right? And it really takes the full day. Now, I'm going to try to summarize so many things in just a short time. Now, it might take approximately around 2 hours to go through the whole session or summary. The first hour will actually tell you about what is the concept, what is system thinking. The second hour is about the application, the practical application of system thinking, followed by another concept which systems thinkers actually use to dissolve challenges in healthcare and in social arenas, right? And I think this will be the icing on the cake. So please don't miss the last part of the session. It's going to be a bit of a long session because it might take up to 2 hours. The first hour, by all means, is about the concept. The second hour is about the application, and ending with the icing on the cake on something called the ideal design approach, or for creative thinking, or also called the higher order logic. Now, I'm going to start by my talk, and right? By all means, if anything is unclear, just stop me. Now, system thinking in Arabic, let me just minimize this. System thinking in Arabic is called التفكير المنظومي أو التفكير الجمعي, and it actually depicts the term very well, right? It's all about cracking the code of change and transformation. So system thinking actually deals with how to change or transform your service, right? It's part of a Al-Tababa empowerment series or for transformational leadership, right? System thinking is not only for the leaders in healthcare, it's all disciplines, even government officials, right? Or, you know, other disciplines and specialties. The aim of the session is very simple. The aim is to empower and shift the viewer's mindset to a higher order cognitive and personal domains. These domains are critical. These domains are critical for an effective disruptor actions and transformational leadership. And I'll try to explain this term, transformational leadership. What does it mean? The roadmap is as follows. I will start by giving a small historical perspective. Now, I will emphasize 3 important facts about systems thinking, right? What is meant by the cognitive mastery for transformational leadership? What do these transformational leaders have to have in their, you know, to be masters of transformation, right? Why do we need systems thinking, or why do we need to become system thinkers? What do we mean by a system, and what do we mean by systems thinking? Then I will go to the second part, which is system thinking in practice, the golden steps, and we do it in practical using practical examples. And I will highlight the diagnostic and therapeutic tools in system thinking. And I'll finish by a very important component or asset or mastery for system thinkers, which is higher order logic or ideal design approach. The first thing I really need to emphasize is that it is called systems thinking and not system thinking, right? Most people actually, you know, don't mention the S or pronounce the S, but it is actually about systems thinking, not just system thinking. Now, it all appeared in the business arena in the, you know, in the early 90s. It's called the 5th discipline. And the author of the book, The 5th Discipline, Peter Senge, right, actually was awarded the Nobel Prize for actually advocating and advancing this new discipline in the business arena. And it's become an important concept for not only in the business arena, but in all disciplines. And as a matter of fact, the United Nations, the World Health Organization, recommends that system thinking become an important tool for strengthening and improving our healthcare systems. There are many resources available for people who are interested to become really true system thinkers. One of the most well-known is called the Donella Meadows Project, or Academy for Systems Change. And believe it or not, these experts in system thinking are actually have become advisors to the United Nations, to the World Bank, to even to governments, and how to use the tools of system thinking to improve, you know, all sorts of social challenges. So what are the attributes of a systems thinker? Now, system thinker is about transformational leadership. Now, what does this term imply, right? Transformational leadership tend to envision the future, right? It's very important to know that 70% of the change efforts in the world actually fail. Most of these failures are actually because these change agents fail to apply the science and tools of systems thinking. And this is actually when people looked at why Sudan keeps failing, the political and economic failures of Sudan. And this, the primary reason is actually, you know, falls squarely on system thinking. And I will explain that, and you will see it, you know, in front of you later on. Right, system thinking rewires people's brain so that they are transformational in their actions. They become creative thinkers. You know, system thinking helps people become creative thinkers because they end up having to use something called a higher order logic, an important concept for actually dissolving, not just solving, you know, healthcare or other challenges, but dissolving them. It's all about transformational leadership. Now, what's the difference between transformation and change? And this is an important concept that people have to share. Now, if I move from these, huts, ugly huts, for example, in a housing, in a residential area, to this part, so I'm improving from this to this. Now, this is called change. Now, if, however, I move from this sort of huts or houses, right, quite bad looking, to this sort of thing, of building, this is called transformation. So change and transformation are two different concepts. In the change mode, we just improve the system. In the change mode, we just improve the system. The past directs what we do. However, in the transformation mode, we actually bring about new systems. New systems emerge. And this is the beauty of system thinking. System thinking help you develop or improve your system by having new systems coming into place, coming into life. Now, a very good example of transformational change is what happens, right, how a butterfly, nobody who's actually not science trained will actually appreciate that this pupa or larva should become this beautiful butterfly, right? But this is exactly the essence of transformation. There is no relationship to the past. In Sudan, unless the country endorses or the leaders in the country endorse a transformational mindset, things are going to stay the same because you are going to improve but not transform. Now, there are two pillars of transformational leadership. One is called radical critical thinking and problem solving cognitive mastery, and the other one is higher level interpersonal behavioral mastery. This by itself has so many domains. I'm going just to highlight the domains that are critical for radical critical thinking and problem solving cognitive mastery, and to highlight where system thinking falls. Right. Now, system thinkers or system redesign, right, this is one of the important attributes of transformational leaders. The other one is called the higher order logic or ideal design approach. The third component is using evidence, because whenever we have a transformative action, we have to use evidence. The fourth is an important attribute in transformational leadership is focusing on staff more than the service. And you can see that whenever the focus is on the service, right, the staff get burned out and they might even lose their skills. The fourth element is shifting the balance of power. Now, transformational leaders shift the balance of power by empowering their employers or staff, for example, by competency training, or they are empowered actually by giving them higher responsibilities based on a scheme of talent profiling. But an excellent example of how shifting the balance of power becomes transformational is what happened in Sudan December's revolution. Now, Sudan's December revolution was actually a simple example of shifting the balance of power. The balance of power shifted from the government to the people, and the people got rid of the government, right? It's just a simple example of shifting the balance of power. And transformational leaders, they have to learn how to shift the balance of power. And of course, an important facilitator in our in this modern age is obviously accelerators of momentum like technology. Right? These are important transformational concepts. Now, another important transformational concept is, whenever we start a session on system thinking, we tend to ask people, why are you here? And the simple answer is, most people would say we came to learn about system thinking. Now, this just tells that most people are not systems thinkers, right? System thinkers focus on the outcome. They don't focus on the process. I came to learn about system thinking is a process. The outcome is I want to become a systems thinker, right? So system thinkers are outcome focused. They are not at all process focused. And this is different to the usual way of thinking, right? And the reason for that is that when people focus on the how, right, they waste a lot of time. They should focus on the what and the how comes along. how things are done comes along. You people have to agree on an outcome and then work to achieve it. And this is actually one of the major failures in the December Revolution, is that there is no agreed big outcomes, that everybody is sharing and working to achieve. And this is whenever people focus on the processes and don't share a vision or an outcome, right? People tend not to reach these outcomes. Now, why do we need system thinkers and system thinking? Right. Now, system thinking facilitates an in-depth understanding of the health, social, economical, and political challenges. If people understand these very well, they are more likely to devise solutions that are significantly effective or more effective and long-lasting, right? Now, if you look at the socioeconomic failures in Sudan, like in poverty, wars, and inflation, right? Since independence, Sudan has actually, suffered from this. They just keep coming back, right? Every time, we keep saying the same problems: inflation, poor economy, poverty, and so. System thinking helps us see why we are seeing these problems over and over again. System thinking helps people connect the dots. They don't see things, in a patchy way. System thinkers look at things holistically, the bigger picture, and therefore they can connect the dots and find solutions that are exactly what is needed, right? Now, if I told people that the problem in Sudan now, the economic difficulties now, are because children of Sudan 15 or 20 years ago were short for age, many people would actually laugh. What has short for age, or they are just short? Why having short children have an impact on the economy, right? System thinkers will straight away connect the dots. And they can come up with why being short for age, right, leads to poor economies, right? It's all because of system thinking. System thinking allows people to connect the dots, right? And if I told you that in Singapore, for example, there was a dramatic reduction in their fertility rate in the Singaporean population. And if I tell you that it's all because their houses became much more expensive, people would laugh and say, what has expensive housing to do with having a low fertility? But these things are all interconnected. The second thing, system thinkers identify the leverage points. So what are these leverage points? Whenever we do a root cause analysis, why we have inflation, right? You will find loads of causes of inflation, right? And these loads of causes of inflation, like root cause analysis, you would say, but which one is more important? Which is more effective in getting rid of inflation? Now the government is saying, okay, we are going to control the black market, the hard currency black market, or we're going to change the currency, right? Now, are these leverage points? Are these the areas which are really effective in changing the status quo and improving the inflation, right? Most likely it is not, because they are not looking at the bigger picture. They've just chosen two things. This is called the knee-jerk reaction. They're working on these. They're not going to work because many other governments before them have tried it and they failed, okay? System thinkers allow people to find the leverage points. They don't only find root cause analysis. There are close to 30 causes for the poor quality of healthcare in Sudan. But which one shall I tackle? Which one shall I tackle? The medical staff issues, the management issues, the environment issues, material issues. Which one shall I tackle, right? System thinkers, they have this, unbelievable ability to find out the leverage point. Now, leverage point, or نقاط الرفع والارتقاء, right? For the same amount of, for example, cost, I can actually tackle a root cause and get a bigger impact, get a more successful impact. So system thinkers actually know the tools which can tell them decide what are the leverage points? Where should I focus my interventions to improve the service, to have a sustainable and powerful effect, right? It's something that only system thinkers are able to do because they know the tools, they know how to use the tools to get to the leverage points. So we need actually high or strong leverage points, right? Is, controlling the black market, the foreign currency black market leverage point is actually changing the money leverage point, right? System thinkers know how to find out, is it a leverage point or not? Now, let's go to another thing. Now, we have an epidemic of non-communicable diseases. These are all over the world, but Sudan is not immune. We have problems with hypertension, obesity, diabetes, and asthma. Asthma is becoming, a serious issue in Sudan, like obesity and diabetes and hypertension. Now, system thinkers know that the Federal Minister of Health is powerless to actually do something effective against this. The Federal Minister of Health might build centers for obesity, centers for diabetes, but these are not the leverage points. These are not going to solve the issue. So system thinking is actually, allows people to holistically find solutions, right? And you find that it's actually most of the time multidisciplinary. Health issues are not for the health ministry only, right? They are unlikely to do it, unlikely to succeed in controlling them. So these are the important things, right? Systems thinking allows people to know why we keep saying the same problem over and over again, right? Decide where the leverage points are and what are the most effective leverage points. System thinking, right, tells us that you cannot just look at one problem from its only component. Health issue, look at it from the health part. No, you need multidisciplinary inputs actually to dissolve or solve a challenge. So what we're going to an important thing, which is what we mean by a system. Now, there are many definitions, but simple ones are a system is an organized whole, or a system is anything that has a name. Even a chair is a system because it has legs, it has it has a back, it has somewhere to sit, it has a cushion, it has maybe wheels. So it's a system, working together. Everything that has a name is actually a small system. A hospital is a system. A whole country is a system, right? A system is an entity with interrelated and interdependent parts. These are two important concepts. They are interrelated and interdependent. A chair with no back is no longer a chair. A chair with no legs is no longer a chair. They are interrelated and interdependent. A car has so many parts, right? The interaction between them makes the car, run. But if you take every part on its own, it doesn't make a car, right? Things are interdependent and they're interrelated and interdependent. Now, when you put things together, this interdependence and interrelatedness, you end up with a new property, right? Now, water is wet. It's made of two gases, hydrogen and oxygen. But it is wet now. It has nothing to do with the original, status of its components. And so a system is never the sum of its parts. It's the components together making it a system. Now, healthcare is a system, right? It has interdependent and interrelated parts. Now, let's look how, right, this actually works. There is a high level of this interdependence and interconnectedness, right? And there is, in healthcare system, there is the human factor. Now, when a human factor comes into a system, the system is actually called or qualified as a complex system. A car is a simple system. A bicycle is a simple system. If a battery actually stops working, right, in a car and the car doesn't run, you can just change the car and the car works. The car runs, right? But bring a human being, and that human being actually every time leaves the lights on and the battery loses power, right? It has become complex. Next time, you cannot just solve it or dissolve the problem by putting a car, because it's going to fail again. A human factor has come in, it makes it a complex system. So whenever humans come into a system, the system becomes a complex system. Now, let's look at this corona pandemic system thinking, the interconnectedness, how this system thinking had actually surfaced when the coronavirus came into play. Now, the coronavirus is an infection, right? It should affect only maybe the part of the system, really the infectious diseases component of the service. But as a matter of fact, the whole healthcare system was affected. There was cancellation of elective procedures, closure of ambulatory services, restrictions of ER visits, closure of healthcare hospitals, an unbelievable impact on every part of the healthcare service, everything. Even the mental health of staff were affected, right? There were new infection control practices. The coronavirus actually made the system thinking concept, surface up, and people for the first time have said, oh my God, look of how the things are interconnected in the healthcare. Not only that, it's a problem in the healthcare service has affected all other systems. So, there were social and community restrictions, travel restrictions, education, schools were closed, manufacturing, wholesale, retail closures, construction, environment, even environmental impacts. Now, this is what we call the consequences of the epidemic. Now, the consequences of a social problem or even a social intervention could be intended or unintended, right? Closure of hospitals is intended. They closed, for example, the ER services, or stopped footballs, or stopped airplane travel. This is an intended action. But then we have unintended consequences. The effect on mental health, for example, this is an unintended consequence. The effect of on other non-corona chronic diseases, for example, this is an unintended consequences. Now, system thinkers know that for every action they take, there are intended actions, and there are unintended consequences. And system thinkers are actually so skilled in implementing the intended actions, and at the same time, looking and dealing with the unintended consequences. Now, what are the building blocks of a system? Now, a system in its basic component has three parts: the structure, process, and outcome. The structure is the input, the process is the way, the operations, and the outcome are the outputs. An important thing that system thinkers actually realize very well is that if you change one part of the system, it will affect the whole other parts. If you change the structure, the processes automatically change and the outcomes change. You cannot change one part of the system and expect the other parts not to be affected, right? For example, you have in an endoscopy unit, you said that we are going to have a service where all patients coming with upper GI hemorrhage will have an endoscopy within 24 hours. And then you say, okay, I will allocate one of our endoscopy suites to this endoscopy service, right? Then you will say, okay, we have actually sorted this problem out. That we have all our patients having their endoscopy within 24 hours. The unintended consequence will be that you have actually you have reduced the number available, the suites available for elective endoscopy. So the whole services will be impacted. So you have intended and unintended consequences. The whole system affects. The outcome would be less satisfaction of patients or less number of endoscopies per year for the elective endoscopies. The healthcare system is made up of a series of interconnected and interdependent parts. And these all act together because they have a common purpose. They produce results impossible by the action upon alone. You cannot have a healthcare, a hospital without a laboratory service, a radiology service, a nursing service. They all work together. A portering service, a transport service, an ambulance service. Every one of them is a system on its own, and they make up a component of the system, and they make up the bigger system, the hospital. Now, the structure is how the service of business is organized. The process is how the service is delivered, and the outcomes is how the service is assessed. So these are the three components or the basic components of the system, right? And just to give an example, the structure, or also called the anatomy or the organogram, is made up of the staff, the departments, the equipment, supplies, the environment. The process is actually the pathways, protocols, the physician orders, nursing and housekeeping, and the transport. And obviously the outcomes, the classic outcomes in any healthcare service is the number of deaths and disease, disability, discomfort, dissatisfaction, and destitution of cost. And these are the 6 Ds. So for every system, these are the components, the structure, process, and outcome of a healthcare system or a healthcare unit, right? Now, very importantly, if there is a very well-known saying by the president and CEO of the Institute for Healthcare Improvement, right? That was a long time ago. He said, every system is perfectly designed to achieve exactly the results it gets. Every system is perfectly designed to achieve exactly the results it gets. If a system fails, it means there is something wrong with the structure, the process, or in its agreed on outcomes, right? So, and that's what implies that if you want to improve the system, you cannot only work on a structure or process to improve the outcomes. We have to work on both of them, the structure and the process. And this is systems thinking. And for example, if you want to improve the heart failure service, you have to redesign the heart failure service, because system thinkers are redesigners. They redesign the service. So instead of having just staff like, doctors and nurses and these make the anatomy, no, you have a heart failure multidisciplinary team, you have the heart failure or nurse educator, you have cell management tools, you have heart failure clinic and heart failure rehab units. This is the new redesign, the new structure. And then the process also changed. There is a heart failure pathway protocol, there is a discharge planning checklist, the competency training to make sure the process of training is actually equips your staff to be on top. And then obviously, instead of looking only at the 6 Ds, then the outcomes are now different. You are looking at patient satisfaction and staff satisfaction. So system thinking allows people to have a better look at the system and redesign their services. And they work on all the aspects of the structure and process to improve the outcomes, right? System thinkers look at the whole. They don't look only as parts. You know, blindfolded people, when they are by an elephant, somebody who touches the elephant's nose, he will say it's a spear, or they touch the horn, they say it's a spike, right? It's a snake or a spike. They touch the thing. They touch the leg and they say it's a tree. System thinkers look at the things holistically. They only don't look at only part of the system and forget the others. Now, coming to the actual system thinking itself, what does it imply in more detail? Now, system thinker is a discipline for seeing wholes. It's a framework for seeing interrelationships rather than things, for seeing patterns of change rather than static snapshots. Now, it is considered a paradigm and revolution. A paradigm means that it's a transformational way of thinking. And it is revolutionary because it allows people to be more creative. And because they redesign the service, they can learn, they become the learning organization. And they are good in solving and dissolving problems. Solving is, you just, solve the problem, but dissolving is getting rid of it totally. And they are good in complex social systems like healthcare or other social services. It helps people to have a better understanding of the bigger picture. And therefore, they can redesign the service in a more scientific way using evidence. And their actions become transformational. System thinkers are good in identifying the best leverage transformation areas. They know, okay, I have, for example, here, I have a gynae service or a radiology service, right? And I want to improve it, right? They can look at the structure, process, and outcomes, and then still don't know where to work. Where are the best leverage points? But then system thinkers can help them decide what are the best leverage points. An important concept in system thinking, which makes it actually more successful than other ways of improving systems, it focuses on people, right? It's people are at the heart of system thinkers, and that's what we call system intelligence. The most important thing are the people, so they focus on people. And very importantly is whenever system thinkers want to have an improvement process, they know that they cannot do it on their own. It's a multidisciplinary approach. There is no way that the Federal Minister of Health could get rid of obesity or diabetes or asthma on their own. This is, they cannot do it. There is no way that the, Ministry of, Finance and Economy or whatever, right? They're going to sort out the problem of inflation. This is absolutely wrong. They cannot do it on their own. This has to be multidisciplinary, right? We need system thinkings whenever we're dealing with social systems. An important thing is that system thinkers are outcome focused. Because they are outcome focused, they decide what the outcome is and then think backwards. And people who actually, the Professor Nabag and academic people who are teachers, right? They know that in the competency-based training program, the competency is about asking, agreeing on an outcome from competency-based training and then working backwards to build it up. So you know exactly, you build things to achieve your goal. And this is also called design thinking. You design things based on the outcomes you want. So it's all about design thinking. So they say it's about moving forward by thinking backwards. Right. There are 5 golden steps what system thinkers do. Right. If they are faced with a challenge, they have a problem, inflation, poverty, flooding. Okay, we have flooding in Sudan these days. They look at the root causes. When they look at the root causes, they use the tools to find the leverage points. This is unlike the usual root cause analysis. Root cause analysis tells you the root causes, but doesn't tell you which one is more important, which one is more effective to tackle, to start tackling. System thinkers, they have their tools to identify the leverage points where your action would be most effective. You have limited resources, so you have to use the right leverage points. And then once you have decided on the leverage points, you redesign your system, and you do it creatively with system intelligence in mind. Human being is a major factor, and use evidence-based. You know there will be there will be unintended consequences. You work on this, prevent unintended consequences or deal with these unintended consequences. You closed the elective endoscopies, right? So the elective endoscopies will actually, the waiting list will get worse, and patient satisfaction, and more patients are going to be harmed. So you have to deal with these unintended consequences. An important thing in system thinking is that they learn, they have feedback, because they monitor the change. They monitor the change to know what is happening and deal and improve the system as they get along. So system thinkers look at the big picture. They find the root causes, identify the leverage points, redesign the system, and they transform the system as such, right? They deal with the unintended consequence in the meantime, right? So this is the concept of system thinking. Now, before I go to the diagnostic and therapeutic tools, the application, the practical application of system thinking, I will, leave the floor for Dr. Anoon to actually to present the present her part. Right, is Dr. Noor ready?
Thank you. Thank you, Dr. Imad. Many thanks for joining us today. I'm sorry I couldn't introduce you in the beginning due to technical difficulties, but I would like to introduce Dr. Imad Hassan to our colleagues in Sudanese Junior Doctors Association in UK. And on behalf of SAJDA UK admins, I'm pleased to collaborate with Tababa Advanced Training Center and to share their valuable online session tonight on system thinking. And I hope this will be the beginning of more valuable work in Sudan in future. Thank you so much, Dr. Imad, and please carry on.
Right. Well, thank you very much, Dr. Noor. Actually, we are privileged to have Dr. Noor with us. She's actually one of Tababa members from a long time ago, and she's back to Tababa with two hats, really, part of Tababa and part of SAJDA. So I welcome you again, and I hope our collaboration will not stop here, right? We can both benefit from each other. Thank you very much. So I'll go back to the second part of my talk, but I will just maybe for a minute or two, if anybody has any question. So if there are no questions, then I will proceed to the second part. Now, the second part is actually about what are the diagnostic tools and therapeutic tools that system thinkers actually utilize, right, to actually solve or dissolve the social or healthcare issues. Now, whenever actually there is a healthcare issue or a social issue, and if you have a problem, a faulty system, right, there is usually people think of a solution. They identify the root cause by a knee-jerk reaction. Just like the inflation, they say, okay, it's because of al-mudaraba fi al-naqd, okay, the black, the foreign currency black market, okay. This is a knee-jerk reaction. This is a hunch. Well, I think that's the problem. You know, people are coming late to work. The hunch would be, okay, they're lazy, they are irresponsible. The other way that people try to find out the root causes is actually by looking at using the root cause analysis and actions tool. And many people working in quality improvement will actually come across it, and the fishbone diagram that people use. The fishbone diagram that people use to try to find out the root causes. Now, the third way is what system thinkers do. They look at all relevant and interrelated elements, and they actually put them together, right? And they relate them to each other, because none of them is actually is looked at as an isolated root cause. And then when they look at the change or the improvement in healthcare, the knee-jerk reaction, right? They say like an inflation. Well, the root cause is the black market for foreign currency. So we are going to work on the black market. This is a knee-jerk reaction. People who use root cause analysis, they actually try to reduce the problem to a single one or two or three problems. They say, okay, there are this problem with the black market. There are actually anti-government or anti-revolution people working on that. So they try to list the root causes and then try to work on these. The system thinkers, after they have looked at these root causes, they will actually look at the leverage points. They look at where we should focus our actions, right? Because they know that not all actions, towards one particular root cause will actually work. They know some root causes, intervention at certain root causes will have a better outcome, right? There are certain core principles, right, that sets it apart from root causes and other paradigms, right? There is never a single cause to any problem. So that's true actually in healthcare. Whenever, for example, medical errors in a hospital, there is never a single cause. There are usually multiple causes. And an important thing is that whenever there are multiple causes, any mono actions or quick fixes create new or feature unintended consequences. And the endoscopy issue is a simple example of that. So you cannot have just a mono action or a quick fix to solve the problem, right? People who do root cause analysis, they use analytical thinking, right? And they just, enumerate material, methods, measurement, mother nature, man or machine. But people in system thinking, in addition to doing that, they actually link them together because they know that they're all interrelated and interlinked. System analysis in simple systems. The car is not working. ما شغال الإجنيشن والله البطارية. Simple analysis, right? This is called the reductionist mode. We just look at the problem in a simplistic way, right? In complex systems, right? No, we use something called the synthesis mode because there is lots of interconnectedness and interdependency. We cannot just look at just one part and say this is the problem. They are all interconnected and interrelated, and this is called the synthesis mode. So we have two processes of reasoning. One is called the reductionist or the root cause analysis. We examine part by part. And the other one is called the system thinking or examine the whole. So this is system thinking in the form of reasoning, right? And analytic thinking, we look at the parts, while the whole system thinking, we look at the wholes and looking at the interactions, right? Now, to problem solving that attempts to balance holistic thinking and reductionist thinking. In practice, it means taking a step back, right? بدل نشوف الفيل بس نجي نعاين نمسك كده نقول ده ضنب ونمسك عاين ده نقول ده this is the tail and this is the snake, right? No, we go back and have the bigger picture. In essence, we are zooming out to have a better look. يعني احنا بنصغر الحاجة عشان نشوفها on its whole. Right, it's very important that system thinkers know that they cannot solve any problem on their own. They know that there are inputs, right? And we have to break out the traditional silos, and we have to have fresh perspectives or creative solutions. عشان كده system thinkers are more creative than people who are ناس الكواليتي اللي بيعملوا بس root cause analysis. Now, system thinkers are definitely more creative. Now, there are two very simple tools that system thinkers use to have a better understanding of the problem and decide on the leverage points. These tools, one is called the biometrics tool and the other one is called the iceberg tool. Now, these are really basic, simple tools. They just help people, solve the problems in a very simplistic way. Now, what is the 7 system or the biometrics tool? The biometrics tool actually starts from the biometric systems theory, right? And this biometric system says that every system has 7 leverage areas or different aspects. These 7 aspects are primarily leverage areas. These are where if you work on the system in that sense, you are likely to achieve a major improvement in the system. Now, the 7 system aspect from the biometrics theory say it has the 3 components: the structure, process, and outcome, exactly the same. The outcome, the structure, the process, and the structure, process, and outcome. The same basic components of system are there in the biometrics tool. However, they have added 4 new items. The first one is the environment. They said the local and surrounding facilitators or barriers are important in helping achieve the outcomes that you want. And for example, a bad environment in the hospital will definitely, stop people from doing their best. A crowded environment, a dirty environment. So it's important to also make sure that the environment is right for the outcome you want to achieve, for the aim or vision you want to achieve. And it's not only the local environment, even surrounding facilitators and barriers. System thinkers don't only rely on the local resources, but they look for who else can help me in achieving my goals, surrounding facilitators and barriers. And this is an important concept. The resources available. Do I have the right material intellectual assets? Are my staff capable? Do they have the right competencies? So they look at whether they have the right resources to achieve their outcomes. The third element which is added is the organizational culture. Now, organizational culture, a simple one would be, for example, the safety culture. We were talking about it just a few days ago. A safety culture in an organization like a hospital changes people's mindset. And if you change people's mindset, you change their attitude and behavior. So if we say we are all for safety, and the hospital says our organizational culture is safety, then our focus is safety. We get obsessed by safety. All big organizations, Google, Microsoft, Amazon, all of them, right? They have their organizational culture. Organizational culture changes the mindset of people and changes the way they behave, right? Changes attitude and changes their behavior. Unless you have an organizational culture, for example, we have a culture in where I work, in the section where I work. We have a culture being on time, timely. Everybody is in front of a computer by 8 a.m., starting the word round. This is the organizational culture. We are 2 minutes past 8, 3 minutes past 8, everybody is on time. And we stay until 5. People don't leave before 5. This is an organizational culture. If you have an organizational culture, it changes people's mindset, attitude, and behavior. A very important component in every system is governance or regulation and monitoring. A system with no governance, to see are you heading correctly to your goal or not, without monitoring, without regulation, everything falls apart. Unless you have a unit or a department or a hospital or a ministry with all the 7 components, right, you are unlikely to succeed in achieving your goals. If you want to start a new unit in a hospital, you have to make sure that all the 7 components are in place before you actually say that you have developed a unit, a successful system, right? The practical meaning of the 7 system aspects is that the 7 aspects of an organization must be understood for it to be understood as a whole. You cannot have a good holistic look at an organization without looking at the 7 aspects. These 7 aspects are the strategic levers. They are leverage points. If you want to improve the system, you look at structure, process, and outcome, just like the basic thing, but don't forget the 4 new ones. The environment, the organizational culture, the monitoring, the governance. Okay, you have to look at all the other aspects. Any shift in one of these 7 aspects can produce big changes in the whole organization, right? We changed the culture to being on time, right? Timely service. Then the whole service actually became like this. The whole department, as a matter of fact, the whole department now knows that the doctors are staying, they cannot leave. The secretaries, everybody, the nurses, everybody is because the doctors are there still. The 7 system aspects provide a framework for a holistic understanding of the business organization or problem situations within these organizations. These 7 aspects are the strategic levers, the leverage points. And they are pillars for building a highly successful organization, business, or service. These are the pillars. Now, the second tool that system thinker uses is called the aspect model in system thinking. And this is a very intriguing tool. As you know, the iceberg has only 10% of it is actually, you can see, above the water line. The 10% of an iceberg is above the water line, right? This is also true. If you see a problem here, underneath there are so many other reasons why this problem is coming up, is surfacing there. So if you really want to know what really caused the problem, you have to go deep beneath the water, right? You have to look at the root causes beneath the water. And these root causes, right, or which lead to this problem are actually divided into patterns, structures, mental and cultural institutional values, right? These are the things, and through these underlying structures, you end up with this pattern. Just to make it easier, now, an event, for example, is having a road traffic accident. Somebody was driving fast, a young man was driving fast and, you know, had a major accident in the motorway. The pattern which just precedes the event is actually driving fast, or speeding there on the road. The underlying structure which has helped maintain this speeding and allows people to speed is having a perfect road, well-paved road, wide road, and there are no bumps or anything at all in the road, right? And so the underlying structure is a perfect road. The mental model may be because, well, I am not afraid of the government, right? Or, you know, it doesn't matter to me if I have an accident, I can have a new car. This is the mental model. So mental models, through structures, through patterns, end up with an event. Now, if I want to get rid of this problem of, you know, road traffic accidents, right? I can actually put a bump or put a speeding camera in here, right, to intervene at the patterns, right? Or I can put a bump or a ramp actually to stop people speeding, right? I can put a policeman or a speeding camera, or I can put a ramp to make the structure not as easy, you know, to help speeding. Or I can actually have an educational program, change the mental models or the cultural institutional values, right? Now, this one will cost me a lot of money. This one will cost me a lot of money. This one might be cheaper, and in the long term will reduce. Is usually more effective. That's why they are actually put at the bottom. Mental models, right? If you have a knee-jerk reaction like having, you know, a policeman or speeding, right, to fix the problem, then the mental models and underlying structures will keep creeping up. But if you actually work on these underlying structures, the mental models, you actually end up with actually transforming or improving the service, right? The event is what just happened. The pattern is just precedes the event, and there are trends and structures which help it. What are the things which actually maintain these patterns and them? You achieve transformation, you redesign, you transform people's mental models, you achieve transformation. You can redesign so that the road does not allow people to speed up, for example, by having ramps, okay, the systemic structures, right? Or you can actually intervene at the behavioral patterns, the speeding, by having, for example, a policeman watching or a speed camera, okay? And then to stop these. Now, an example of how normative is simple, right? When Islam started, it started with a change in mental model. The whole of the Islamic, when the Islamic religion started, Rasulullah, what did he do? He just changed people's mental models. Allah, there is only one God. When we are good people, we have to behave like this, we have to do this, we have to worship this way, right? It all started with mental models. So mental models can be transformative, right? So mental models, you can transformative. Resolution is through impacting the negative mental models. You work on the negative mental models to become transformational. You resolve the systemic structures which lead to these patterns by designing or redesigning the system, right? you can resolve it here by anticipating and preventing. Preventing it by having, for example, policemen, that they know there is a policeman that stops people from speeding. They know there is a speed camera, they stop speeding. And therefore you get rid of the event or the symptom of the problem, right? Now, let's look at an interesting issue, the children stunting and system thinking. Now, this diagram is actually about the root causes of why we have children stunting. Children stunting is about having children who are shorter for their age. They don't have short stature. It's not a disease. They don't have short stature like in pediatrics due to endocrine or genetic diseases. They are just short for age. They are short for age because of household issues like inadequate care, there are infections, there are food and water safety issues, there are poor quality foods, there is no complementary feeding, inadequate breastfeeding. But there are other causes like this, there are social and cultural issues, there are health and healthcare issues, there are water and sanitation issues, there are people are not actually harvesting the right crops, there are political and economical issues, and there are issues with education. You know, it's not only feeding the poor nutrition or poor health, but even education, because an uneducated parents also will lead to stunted growth because they cannot stimulate the brain, okay? It's the brain of the children because they are uneducated. Now, what will have the stunting? What's the impact of stunting? Now, stunting impacts the whole system. In system thinkers, it's not unusual to have a small health problem impacting the whole system, the whole country. In the short term, stunting increases the risk of death due to infections such as pneumonia and diarrhea. In the medium term, stunting affects the cognitive, education, and behavioral aspects of child development. In the long term, stunting translates into lack of physical stamina. يعني عضلاتهم أقل, they are not as strong, and poor cognition, they are not as intelligent, resulting in lower economic productivity and wages. The effect of stunting are intergenerational. You have low birth weight, right? People, stunted children, more likely to have also stunted children again, okay? Now, the impact is unbelievable. There is 4 times more likely to die because they are stunted. Their IQ score is actually 11 points less than their matched age. The income, when they are adults, they earn less. They actually 22% less. And look at this. The gross domestic product in societies where stunting is prevalent is as high as 16%, right? So you have stunting 20 years ago, you end up with reduced gross domestic products when they are adults, right? It's an unbelievable consequence, right? Added to that, stunting is associated with obesity, diabetes, and cancer. Stunting is associated with oppressive labor and poverty. Stunting recycles from generation to generation. Now look at Sudan. Sudan stunting, rate is around 40%, right? 40% stunting. What do you expect the economy to be in Sudan from stunting in another 15 or 20 years? So why do we keep seeing poor economic growth? One factor is stunting, right? If we don't tackle the issue of stunting now, we will pay the price in 20 years. And how do I manage stunting? So I have to do an iceberg, right? The WHO says stunting, you have to ensure maternal nutrition. You have to ensure maternal nutrition and care during pregnancy. You have to prevent teenage pregnancy. You have to intervene in the first 1,000 years. You have to improve water and sanitation, personal hygiene, okay? So there are areas in agriculture, hygiene, healthcare, and gender equity, laws and things. Right? There are so many multidisciplinary interventions. And when you look at the systematic review of how to get rid of stunting, right, almost half of the intervention are not related to health. So you cannot achieve, you cannot get rid of stunting by just improving nutrition. Okay, somebody has to mute their mic because they can hear them. Right. Actually, in that systematic review, they've actually written are actually the 7 components of the biometrics tool. It's all about cultural values, multidisciplinary environmental resources, changing in structures, changing in process, and changing in governance. So they have actually employed the 7 systems aspect, without knowing, to achieve a control of stunting. And if you put it in an iceberg model, the stunting syndrome is a syndrome because people are not stunted in height only, but they have poor immunity, they have infections, they have poor IQ because they have neurological issues, and they have poor musculoskeletal system. So stunting syndrome, their strength is less. So if you look at what is the pattern which just comes before stunting is usually related to paternal issues and environmental issues like unemployment, poor income, poor education, and ill health, right? And then you look at the systemic structures, lack of access to education of training, poor governance and health services, poor environmental services. If you look at the mental models, the poor community and mental and maternal health literacy, preconception, because if you want to reduce stunting, you have to intervene preconception and during pregnancy. Breastfeeding, right foods, birth control, education on hygiene practices. You have to teach people how to be good parenting skills and education. So if I want to intervene to get rid of stunting, now these are the areas where I should intervene, where the systemic structures and mental models. And as a matter of fact, this is a class, right, where actually they brought all the mothers, right, for this multifaceted intervention, where people actually have, education, vaccination, education on family planning, breastfeeding, how to prepare for pregnancy, and so forth, right? Now, the other example I quoted was the issue of diabetes and obesity. Now, diabetes and obesity, the pattern is pre-diabetes or obesity, right? What are the structures which gets people to develop obesity and pre-diabetes? These are poor education, illiteracy, poverty, lack of exercise, because not enough open spaces, psychological stress, poor regulation of the food industry. People are, filling their foods with so much calories, poor public transport. Now I would say, what has public transport to do with pre-diabetes and obesity, right? But it's an important component. Cars more than the public transport. The longer you stay in your car, the longer you are the more likely you become obese and develop diabetes. And this is proven by evidence. The longer you stay in your car, the more likely you become obese and become diabetic. There are mental models like inactivity, poor dietary habits, tobacco use, social cultural norms, obesity is good, right? Now, these are the issues that need to be tackled. You cannot manage diabetes and obesity by opening diabetes centers and obesity centers, right? This is totally wrong, right? Now, tackling the epidemic of obesity would entail the involvement of health, nutrition, and social experts, food and restaurant industry regulators, build environment and transportation planners, right? الناس اللي بيبنوا الناس المسؤولين على وزارة الأشغال العامة عملوا ميادين كفاية، شوارع نظيفة الناس يمشوا فيها، شوارع سيف، حدائق عامة، transport، عملوا good transport. If I want to tackle the issue of obesity and diabetes in Sudan, the Federal Minister of Health is unlikely to be able to do anything about it. It's not in their hands. It is something totally different, right? This is what system thinkers is about. Now, I'm going to the last part of my talk, which is higher order logic. And this is actually the icing on the cake. And it allows people to have a better way of sorting challenges and problems, right? And you can easily articulate
a better solution. Right. Now, higher order logic. Now, I have to start by actually using, quoting two important statements. One is by Albert Einstein. He said, we cannot solve our problems with the same thinking we used when we created them. If we use the logic that created the problem, for example, poverty because of poor salaries, limits our thinking. أنا خلاص أنا أزود السالري أحل مشكلة الpoverty. This actually, unfortunately, fails to identify the root causes and limits our solutions. So I should not use the same logic of the problem to solve the problem. The logic of the problem says inflation is because السوق الأسود, the black market, right? That's not true. The logic of the problem is not right. The second statement or quote is that if you change the way you look at things, the things you look at change. If you change the way you look at your challenge, you are forcibly made to create and bring to life new ideas, right? I'm looking at it from a different angle, right? And therefore, I'm actually coming up with more creative solutions, and gives me more opportunities. And I'll give you some examples. Right. Now, in healthcare, we tend actually to focus on disease. So it becomes actually thick care, it's not health care, right? The ideal design approach focuses in dissolving the problem by creating a better system, right? Now, it is dissolving rather than solving because the problem inherent in the existing situation disappear with the replacement of that situation. And we are replaced with the new realities. So we've created a new reality. And therefore, we have dissolved the problem rather than just solving it, right? If we use the logic of the problem, right, we stay in the same logic. We stay in the logic that created the problem. And this is not proper. The fact that the logic of the problem is not the logic of the solution. This is an important concept. If we focus on health rather than focusing on disease, then we think of other interventions. For example, I have a patient with diabetes, and if I only focus on Hello, do you hear me? Do you see the
slide ما في أبو.
Is it clear now? Hello?
Oh, clear now. Clear now.
Yes,
Right.
clear.
Okay.
Got
Right.
sort of.
Now,
Yes,
I'll
clear.
just give you some examples. Now, the problem is poverty. The wrong approach is to manage poverty through social support, through donations. The right approach is actually the other way around, is we want to create and build prosperity. So in the beginning, we focus on donations and social support. And yes, this might be a solution in the short term. But in the long term, the right approach is creating or building prosperity. Somebody has to mute their mic. They must, for example, another example is the civil war. The wrong approach is focusing on how to stop the fighting. The right approach would be how to create and promote peace. Now, if the issue
إذا
is
سامعاني
creation of
please mute
promoting,
your mic تفضل دكتورة نايلة. السلام عليكم. إذا سامعاني please mute your mic دكتورة نايلة.
the right approach would be to create.
أيوة that.
الهوست ممكن يعمل لها ميوت لو سمحتوا.
The right approach is to create and promote peace. So once the ideal is looked at, then you have ideas to actually solve the problem of civil war, right? Now we have a problem, for example, lots of accidents from مثلا في طريق مدني. So people say, okay, we should build trauma centers in في شارع مدني, right? Trauma centers are actually to establish and run, but the right approach is actually focusing on road safety rather than building trauma centers, especially in a country where it cannot afford, right? So the bottom line is, when you're solving a problem, do not focus on the problem itself, focus on the ideal. What should be rather what should not be, right? And if you can actually bring about the ideal situation, then the problems that were inherent in the existing situation will disappear of their own accord, right? You look at the problem, you look at the ideal, and then you start creating a new reality, right? And you can use root cause analysis with the system thinking approach to understand your problem. Okay. And once your ideals or outcomes, because we are outcome focused, have been formulated, then you start putting on the strategies that are required to attain or approximate these ideas, and to formulate them and implement them. So in summary, system thinking is to produce an understanding of the system as a whole, or the big picture. What is system thinking? Is an approach to problem solving, identifying leverage points, and for system design or redesign with people-oriented outcomes emphasized, right? And obviously we work on the unintended consequences. What do we need to use when dealing with social systems or systems involving human beings? And whenever we look around, health, economy, environment, crime, everything is actually a system, and we need to use system thinking, right? System thinking, we should all really become system thinkers. We should not actually be reductionist and try, to minimize the causes to small things. نختزلها في أشياء صغيرة. But we have to look at the big system. So I hope that we have now a better understanding of the concept of system thinking and how to apply it in our everyday practice and in our social systems, right? I think it is needed not only by us as healthcare providers, and many of us are actually leaders in their profession at this stage, but even by government officials who really need to use system thinking to sort out the problems of the country once and for all. And thank you all for being with us in this meeting. I hope actually I managed to pass on this important concept, and I hope people have appreciated its importance. Thank you very much for listening.
Thank you, Dr. Imad, for this rich, obese lecture, actually, if I may call it. دسمة جدا, and thank you for putting a clear line between change and systems thinker. And to change, I think we should try to be systems thinker before we think of change.
Thank you very much, Dr. Saeed. Appreciate your comment. If anybody has any comments or questions, make a bit of a complex concept as digestible as possible.
Professor Imad, this is a fascinating lecture.
Any comments or questions from the audience?
Yes. Can you hear me? Hello? Can you hear me?
بروف عماد
So it's say
يبدو ما سامعك يا دكتور مغربي.
Can you hear me? Can you hear me? Yes? No? Anyway,
anybody wants to ask any question or we?
Professor Imad, you can't. I don't know if you.
Yeah. Hello.
I don't know.
معنا بروف مغربي، سامعني يا بروف؟
سامعك لكن ما قادر أنا ما. I just want
لا
to
بروف
say.
عماد.
Sorry. What am I
يبدو
doing?
بروف عماد ما سامعنا.
I can hear.
Can
لا
you
لا
hear me?
سامع أنا سامع.
سامعني؟
لا عنده مشكلة في الصوت يا مهندس كريم. عنده مشكلة في الصوت يا دكتور مغربي.
Sorry.
أي مرحبا يا بروفيسور، أنا سامعك يا بروفيسور، سامعك أنا.
Just a fascinating talk. It takes some time for me to digest. It's amazing, and I hope
الصوت شوية ما واضح.
that we will be able to put that into practice. My question is, does it take only one person or an organization or a group of people to implement systems thinking?
والله مشكور يا بروفيسور. One person to share the concept and then the team to work on it together. When we sat, the problem with the corona, when we sat and used the biometrics tool and the iceberg model, when we used it together as a team, يعني أنا كنت هنا في الرياض and then الطبابة team في الخرطوم. We actually wrote exactly how to tackle a corona using the system thinking approach. Then we wrote it into a biometrics tool, and then we also added to that the iceberg tool. What are the mental models and where should the interventions be and what are the leverage points? And we got it published, right? One of the good and reputable journals, right? So it takes one to bring the concept, right? Because not many people are aware, unfortunately, of the concept. One, to bring the concept and people appreciate what it means, and then start applying it as a team. And then they have to appreciate that at the end of the day, they will need a multidisciplinary input from other specialties to tackle whatever problem they have. They cannot tackle it on their own.
Excellent.
Like it takes one person to highlight the issue.
And then make a
Highlight
group
the
of people.
concept.
Yeah, fantastic. I'm very impressed. Really fascinating. Thank you very much.
Thank you very much.
Hello.
Thank you very much. Thank you, Professor Maghreb.
تفضل دكتور خالد وعليكم السلام.
Assalamu alaikum.
Right, if there are no
Salam.
comments, maybe Dr.
Yeah, I have a comment.
مرحبا يا دكتور خالد.
Assalamu alaikum. Thank you very much, Dr. Imad, for this very nice presentation. Really, I learned a lot. I'm now in Khartoum, and really, really this is what we need in Sudan. And but I have some questions really that I need you to help me with. Taking the situation in Sudan, really, you are talking about the key, the cornerstone for a solid system is the human resources. You know, we have a big problem here in Sudan with human resources. It's all about the motivation. Our staff here are very poorly motivated. Very poor salaries, very poor everything. You know, a health cadre could earn at a maximum about $12 a month. So I'm knowing that if you are going back to Maslow hierarchy of needs, and that the principal needs of the human beings are not met. So how do you expect us to take this idea to the next level? Really, you don't have motivated staff. You don't have, all the well qualified staff have migrated because of these poor economic conditions, and now we are in in the same status. So really poverty is a key issue here, and I don't know how we can implement proper systems in our healthcare system. So this is what I wanted to share, and if you can let us know how we can move forward. Thank you.
Korea, Dr. Khalid, a very important question. As a matter of fact, believe it or not, it's very easy to sort out. Would you believe it is easy to sort out? I'll tell you based on the system thinking approaches. Now, you have two approaches, right? In system thinking, it tells you have to start with mental models and culture, okay? Start with mental models and culture, right? If you start with mental models and culture, you change people's mindset, attitude, and behavior, and then you achieve your goal. So you cannot start by saying, you know, the problem now, okay, we want to help people by increasing their salary. They went on strike for money. Give them money, in another month they're going to strike again. You have not looked at the mental models and the things which actually forces these people. Mental model and structure, root causes. You cannot sort it out by actually just looking at the money. Change the environment. So work on mental models, the environment, the leverage points. The leverage point is not salary. Another thing is shift the balance of power. هم مش عايزين يضربوا قالوا هنا يقول لهم you are responsible, right? What are the things you want to change in the system to make the system good for you, right? Shift the balance of power. When the balance of power shifts, okay, shift the balance of power, make them responsible. عشان هم ما يجي يقول لك والله انت ما عملت لنا. Gives them the responsibility, right? انتوا قلتوا حتضربوا تاني حتقولوا والله الممرضات ما شاطرات. كويس التمريض سيء. حتعملوا انتوا شنو؟ Are you going to improve? How are you going to improve the nursing? Shift the balance of power. You will say the environment is poor, cleanliness, ما في sinks, ما في محل نغسل يدينا, ما في. Okay, you take the responsibility, you change it. Okay, you know, working on mental models, shifting the balance of power, okay, and having a shared outcome, what we want to achieve. Increasing their salaries is not going to solve the problem. It's a knee-jerk reaction. It's a simplistic intervention, right? Quick fixes هذه, right? Shift the balance of power. جو قالوا والله ما ادونا سكن. ما ادونا سكن. Okay. انتوا جيبوا سكن. Right? You take the responsibility. If you really care for the health, the ill people and the hospital and the service, right? You take the responsibility. ليه أنا أجيب لك السكن إذا أنا ما بقدر؟ You take the responsibility. Okay? Shifting the balance of power, making people responsible, right? You know, the problem is in Sudan, people are actually always on the passive end. They want others to do the work, but not themselves. Okay? دايرين مدينتهم تبقى نظيفة لكن هم ما يعملوا حاجة. دايرين المستشفى تبقى أحسن لكن هم مستنين الإدارة تعملها. Right? الإدارة has to shift the balance of power, work on changing the mental models of people, changing the culture, right? You are the change agents. We are empowering you. We're giving you. احنا ده الريسورسز اللي عندنا تعالوا ورونا حتعملوها تستعملوها كيف كويس عشان to improve your service. Unless الناس يستعملوا system thinking ويشوفوا المنتال models where what are the structures we maintain الحاجة دي بتدي للإضراب, right? It is not the salaries حتجيب الإضراب الإجابة الإضراب في مليون سبب ثاني. Okay, you look at all the root causes, identify the leverage points, work on all these, right? ولكن سؤالك إجابته سهلة, right? Unless people look at the system as a whole, الإضراب حيستمر من أيام جعفر نميري لغاية ما الحكومة الجديدة ولغاية ما تجي الحكومة، لو جات حكومة منتخبة الإضراب حيستمر. ليه؟ لأنه people are not thinking they are not using systems thinking approaches to solve and or dissolve these problems. They will just continue. Poverty حتقعد، inflation هيقعد، wars حتقعد. الwars وقفت بعد شهر ثاني حترجع. ليه؟ لأنه they didn't use a system thinking approach. They have to use a system thinking approach to solve the problem. The work is on mental models, the structures which maintain the problem, right? We are working on the symptoms. اضربوا عشان ما اديناهم قروش نديهم قروش، ما هيحل المشكله، هيضربوا ثاني. فمشكور على سؤالك الهام يا دكتور خالد.
Can I mention something, Dr. Imad?
Any other question?
تفضل يا دكتور سعيد.
If I may mention that we have to train ourselves or change ourselves to brainstorm. As you mentioned earlier, that people around us, including us, sometimes work the game of the shift blame. Let them do this for us. Let them produce this for us. جيبوا لنا، اعملوا لنا، سووا لنا، حسنوا لنا. While we don't practice the culture of brainstorming and consider ourselves as responsible. And I think this comes from both sides, from the people at the top and from us. If we feel that we are part of the problem and brainstorm and put ourselves in the chairs, even if it is a virtual situation. And if I was in that chair of that responsible person, what I would do, and put it in plain paper, in a pencil and a paper, and put my proposed plan for the next 1 month, 6 months, 1 year. Maybe this can help us to go into the culture of systems thinkers.
Yeah, but system thinkers has to be done by teams. Cannot be done by one person. You really need teams to look at the whole problem holistically, come up with the root causes and the leverage points.
Yeah.
But your point is that we should become proactive, not part of the problem, but part of the solution.
Absolutely, absolutely. I didn't think I didn't mention brainstorming as a sole brainstormer, because for brainstorming to be active, to be effective, it has to come from a team.
Okay, thank you, Dr. Said. Any more comments or questions? Right. If there are no, maybe Dr. Taysir can.
طيب I think nothing. Okay. شكرا جزيلا كل الساده الاودينس الحضور الكريم، حضوركم الانيق هذه الليله، وجزاك الله خير بروفيسور عماد، المحاضره الوافيه الضافيه، وكثر خيركم، ونلتقي بكم بعد بكره ان شاء الله كوميونتي بيست تريننج ان شاء الله باذن الله تعالى. سبحانك اللهم وبحمدك، نشهد ان لا اله الا انت، نستغفرك ونتوب اليك. تصبحوا على خير في امان الله. السلام عليكم.
شكرا للحضور والطاقم بتاع ATC. بارك الله فيكم، ونلتقي دائما على خير باذن الله.
ما شاء الله ما شاء الله ما شاء الله.
شكرا لكم، جزاكم الله خير.
بارك الله فيكم، بارك الله فيكم. شكرا جزيلا.
بارك الله فيكم. شكرا.
ألف شكر، شكرا جزيلا.
مشكور يا دكتور نون على وجودكم، مشكورين بارك الله فيكم، مشكورين يا خالد.